A drugs raid on Humberside.
Go!
Police burst in to find suspects well known to them. One had been released from the cells that morning. Seeing addicts trapped in what's described as the revolving door of law enforcement has led the local chief constable to conclude the Home Office should no longer be in charge of the government's drug strategy in England and Wales.
I've been involved in enforcement now for over 35 years, and put shut bluntly, enforcement alone is not the solution.
You sound pretty critical of what the Home Office have been doing.
They tend to revert to the law enforcement position and narrative, rather than being willing to look at some more innovative, a greater range of solutions to these long-term problems.
His argument is not for decriminalisation, but the Chief Constable, who's also the spokesman on drugs for chief police officers, thinks the Department of Health should take responsibility for the strategy.
And the weekends just chill out.
Carl has been in and out of jail for drug offences for years, but after medical help is now clean. Treating addicts as criminals, he says, simply perpetuates the problem.
I'd rather say send them to a doctor, because locking up and throwing away the key, really, that's not going to get you nowhere, to be honest.
In a report out today, the British Medical Association agrees, saying doctors should have much more of a say in framing national drug policy.
Drug addicts are seen as criminals, and that puts them off from seeking medical help. And I think that's a great pity, because first and foremost, the drug addict should be seen as a patient, certainly by the medical profession, and they need our help.
Treating illicit drug use as a health issue rather than a crime was actually the official policy for most of the 20th century. Indeed, it was known internationally as the British system. But the Home Office is adamant we shouldn't go back to that. They say the current policy is working, the number of people using drugs is falling, and the number of people in treatment and coming off drugs is rising.
The idea that drugs policy should go to the Department of Health is a complete nonsense. It's primarily a law and order issue. The reason being that the government does have a responsibility to protect people, particularly children.
A committee of MPs recently recommended responsibility for drugs policy be shared between Health and the Home Office. The government looks unlikely to agree. Mark Easton, BBC News.